What are the specific subtypes of TNBC, and why do they matter? Triple-negative breast cancer is a complex disease that many people think of as one single type, but in reality, it is made up of several distinct subtypes. These subtypes are identified based on differences in gene expression, biological behavior, and how they respond to treatment. Understanding these subtypes is crucial because they influence prognosis and help guide personalized treatment options. The most common subtypes are called basal-like, which includes two main groups known as basal-like 1 and basal-like 2. These make up a large portion of triple-negative breast cancers. Basal-like tumors tend to grow quickly and are more aggressive. They often have high levels of certain proteins called cytokratins, especially cytokratins 5 and 6, and frequently show mutations in the TP53 gene. These tumors also overexpress epidermal growth factor receptor, or EGFR, which can be a target for specific therapies. Because of their rapid growth and resistance to standard treatments, basal-like triple-negative cancers usually have poorer survival rates. This makes research into targeted therapies, like EGFR inhibitors, very important for improving outcomes. Another group is called mesenchymal and mesenchymal stem-like subtypes. These account for about 10 to 15% of triple-negative cases. They are characterized by high expression of genes involved in epithelial mesenchymal transition, a process that makes cancer cells more invasive and capable of spreading. The mesenchymal stem-like subtype tends to grow more slowly than the mesenchymal one, which can influence how they respond to treatments. These tumors often respond less well to traditional chemotherapy but might be more receptive to targeted therapies that focus on their specific biological pathways. The immunomodulatory subtype is quite different. It is characterized by the presence of immune-related genes and signals involved in immune response. Tumors in this category tend to have a better prognosis because they are more likely to be recognized and attacked by the immune system. This subtype is especially interesting because it suggests that immunotherapy, which boosts the body's immune response, could be an effective treatment option for some patients. The luminal androgen receptor subtype is driven by androgen receptor signaling. Unlike other triple-negative cancers that are basal-like, this subtype expresses luminal markers and is influenced by hormones similar to those in hormone receptor-positive breast cancers. It does not have the basal cytokratin markers but instead shows high levels of luminal proteins. This subtype may respond to therapies that target androgen receptors, offering another personalized treatment pathway. Knowing these subtypes matters because they help predict how aggressive the cancer might be and what treatments are most likely to work. For example, basal-like tumors tend to have the worst outcomes and may need more aggressive or targeted approaches. Immunomodulatory tumors might benefit from immune-based therapies, while luminal androgen receptor cancers could respond to hormone-related treatments. This detailed understanding allows doctors to tailor treatments to each patient's specific tumor biology, moving away from a one-size-fits-all approach. In addition, identifying these subtypes helps researchers develop new drugs and clinical trials aimed at specific tumor types. It also provides insight into prognosis, so patients and doctors can make more informed decisions about treatment plans. While triple-negative breast cancer remains a challenging disease, understanding its subtypes opens the door to more effective, personalized therapies that can improve survival and quality of life. Always remember, each person's cancer is unique, so it's essential to work closely with healthcare professionals to determine the best approach based on individual tumor characteristics.